Well, then we're recording.
Have any of you had to wait in the ED waiting room for hours upon hours?
Yeah.
All the time.
Wait no longer. Stringer has solutions that can limit that time that you have to wait either in the emergency department or the waiting rooms. And I will be showing you one of those solutions. This tracking list is in the FirstNet solution, and tracking lists are within the tracking shell. So a tracking shell is just a group of tracking lists, and the tracking list is a group of patient rows and data columns that the ED clinicians use for information that pertains to their workflow. So if they're a nurse, they'll go to an ED nurse tab or the ED nurse tracking list. If they're trying to triage a patient, they would go to the ED triage tracking list. And these tracking lists allow clinicians to have more time caring for the patient rather than searching multiple places for information, which is where that time of sitting in the waiting room becomes less. So right now I'm going to take you into the domain and show you what the tracking lists look like.
Bring it back onto your screen. Does it hit function F7?
Hit what?
Function F7.
Okay, so up here are the different tracking lists, and all of these tracking lists combined is the tracking shell. And like I said, if you were a nurse, you would go to the nurse tracking list. If you were triaging a patient, you could go to the ED triage. If you want to see recently discharged patients, you could go here and see the recently discharged. So I'm going to take you to all beds. And at the top of every tracking list is this row that has the patient, and you can select any of those patients that are on that tracking list. If that patient isn't on the tracking list, you can't select it. This WR stands for waiting room, which is the number of people that are in the waiting room. The total is the total number of people in the waiting room and the emergency department. Average LOS stands for average length of stay, so all those patients combined, what is their average length of stay in the emergency department. And then median is the median length of stay. And this filter right here, you can filter out this tracking list to show just people that are greater than 18 years old or that are on the fast track. You can also edit this filter list, which I will show you in a minute. And then this next row is your tracking toolbar, which are one-click applications. So instead of doing multiple clicks, Cerner is all about one click. So instead of going into right-clicking and going into these, which are the exact same as this toolbar, you can just click these icons up here. So this first icon is the pre-arrive. So if somebody's coming in an ambulance and you want to put that patient on the waiting list, the ambulance would call, and Callie will talk more about that. So we'll go on to the next one. The next step, whenever the patient comes in, they'll be they'll do a quick registration, which is just a few things about that patient, just to get them in the system. And then once you've got that quick registration, they'll show up here on the list, and you can attach their pre-register to that person. So you can go up here and click pre-arrival actions and attach that pre-arrival that you created before they got there. Or you can also right-click, like I said earlier, and do all of this. And the pre-arrival patients, they'll be yellow, or be a different background, yellow. So that's how you can know that they're pre-arrival, or you can look in this bed column, and PA stands for pre-arrival. This next one is a full registration, so it'll ask more information, like the insurance and your address and phone number. That should be coming up. But this next one is the triage. If you're going to triage the patient, Callie will talk about that more. I don't want to go too in depth. And then this little D is the domestic violence form. So it's just a few questions if the patient has been physically abused and questions like that the nurses need to ask the patient. This next one is the additional nursing forms. So that's just the registration, the full registration. So encounter information, insurance. The additional nursing form, so there's a few here, and one of them is valuables and belongings. So if a patient comes in and they have their wallet on them and a watch, you would open up this form to show, to write in what they have so that they leave with what they brought in. Add an order, so you click this to add if they needed medicine or other orders. Open a chart. There's several charts that you can open. You can open up their growth chart, an ED summary, which is an in-page, so it's an overall view of that patient. And then this is the events, modify events icon, which you can request a new bed or request to transfer that patient, just different events that you might do for that. And then this next one is a little house, which you would click if you wanted to discharge that patient. So if you wanted to send them home, or most likely you will send them to admit them as an inpatient into the hospital. This view charges is the financial information about that patient, so what they're getting charged while they're there. And then this next one is assign provider. So if you click that, whoever was signed in, their initials would show up in this column. So right now, DD is who I'm signed in as, and I'm an RN, so it shows up in this column. So if someone was signed in as an MLP, a mid-level provider, their initials would show up in this column. And then to unassign the provider, you just click it again. And if you're getting ready to get off your shift and go home, you want to transfer your patients. So this provider is assigned to 2 patients, so whoever they want to assign those patients to, they would click over here and click their patients and just assign them all to that other provider. And then the patient summary report is basically what it says, just a report or a summary of everything about that patient. ED reports are reports that you can run, several of them. One of them that's pretty cool is this greater than X hour log, which you can see who's been in the waiting room for a certain amount of time. So if you want to see who all's been there for longer than 1 hour, so you go here and then location view would be the ED waiting room. And put in 1 hour. And we would have to do the start date would be earlier. And then this shows all of those that have been in the ED waiting room for longer than an hour, which would help for you not to wait as long if you're in there for over 10 hours and they run a report to see who's been in there that long. And then this other columns is where you can edit the columns. All of these are customizable by the client. So if they wanted to rename this for the name or anything, they can rename it and customize it to what they want. Filters is where you can go in and add that filter, like I said earlier. So if they wanted less than 18 years old to be on that filter, they can just click that and it'll show up in that filter drop down. So now you can filter it by age less than 18. And then the last one is the properties, which is just all the tracking lists and the customizable properties of those tracking lists. And then these columns, so the bed, the ED, the first 2 letters start for the facility that they're at. So right now they're in the emergency department, and then the room number is the next 2, and then A is the bed number. So most likely there's 2 beds in a room, but it just depends on the size. And then this next column, this little icon shows that the bed is dirty, needs to be clean. this VI stands for visitors, so doesn't look like, yeah. So this one, you can't have visitors in this room right now. Stop sign. And then this A is the acuity, which is a workload measurement of how many people or how often you need to go check on that person based on the severity of their condition. So 1 is the highest, so they're in a pretty bad condition, and then it goes up from there. The name, age, blue is boy, and then pink is girl, and it shows their age. Allergies, let's go back to all. So this exclamation point means that you haven't filled out the allergies yet, and this blank sun means there's no allergies, and the red means that there are allergies documented. Reason for visit, and then EP is where the initials would go if you were an ED physician. MLP is the mid-level provider. RN is the registered nurse, so all the initials would go in there. NR is the nurse request, so if you order medicine for that patient, and the nurse needs to review that, an icon would show up there. Activities are just assessments or documents that need to be completed. So right here we have medications that need to be completed, or patient care document needs to be completed. IV, if that patient's on an IV right now. Then ECG, if an electrocardiogram has been ordered. So this symbol stands for that it's in process, and then this, if there's a number there, then that means that it's been ordered. Labs are just your labs. 5 out of 4 means that 4 of them have been completed and 1 is ordered. Or right here, 3 of them have been completed and 2 are in process. So the last number means that it's been completed. RAD stands for radiology. It's the chest. So if they've been completed, it's that icon, and then if it's ordered, then it will show the numbers just like the lab. And your events tab or your events column is basically your to-do list. So this patient still needs a doctor's exam, nurse exam, and a full registration. And then this one is the triage. This one is the isolation screening. The home meds need to be filled out. The domestic violence form, like I said earlier. And then the consultation. So that's just basically your to-do list. It makes it easier for the nurse to see what they need to do on that patient. Then the comment column, and then the ADT is just a request for a bed. So if you wanted to request a new bed or request a bed for the patient, you would put that there. And then LOS is your length of stay. So a summary of what I've gone over, the definition of a tracking list, the tracking toolbar, and then the different columns on the tracking list. Does anyone have any questions?
So